simply because we do not have any technology that allows us to regenerate brain function. So in simpler terms, death is defined as the permanent and complete stoppage of functions of vital organs of the body. So these vital organs are often referred to as the tripod of life, comprising of our brain, heart, and lungs. Now that we've delved into the concept of death and its definitions, our exploration takes us further into the intricate aspects of mortality. To gain a comprehensive understanding, we'll now shift our focus to examining the various manners of death and the underlying causes that brings about this natural phenomenon. Understanding both the how and the why behind a person's death is not only essential for our comprehension of human existence but also plays a vital role in medical practice, law enforcement, and public health. So first we have the cause of death. The cause of death is the reason why a person died. It can be attributed to various factors, falling into different categories. So first we have the natural causes. It encompasses diseases such as cancer, heart disease, and physical injuries like stroke, heart attack, and other underlying medical conditions. So these are often results of the body's natural processes or aging. Another category is homicidal and suicidal causes, which involve external factors or intentional actions. This category includes incidents such as shootings, burnings, poisonings, hangings, drowning, suffocations, and other violent or self-inflicted actions. These are typically the deliberate acts that result in a person's death. And determining the precise cause of death is a meticulous process often requiring the expertise of medical professionals, forensic experts, or coroners. They conduct thorough examinations, investigations, and autopsies to establish the specific cause of death. This critical information is then documented on a death certificate, which serves as an official record of the circumstances surrounding a person's death. While the causes of death explains the why, the manner of death provides insights into the how of a person's death. The manner of death refers to the categorization of how an individual's death occurred based on the circumstances and events surrounding it. It provides insights into the broader context of how and why a person died, beyond just a specific cause of death. Manner of death classifications are commonly used in forensic and medical investigations and are typically categorized into several main categories. We have natural death, homicide, accident, suicide, and undetermined. So the first one is natural death. It is specifically defined as a death that results solely from disease or natural bodily processes. It encompasses situations where the ultimate cause of death is attributed to conditions such as heart disease, cancer, or age-related ailments. So in cases where the individual's death was influenced by external factors such as an accidental fall or drowning, the manner of death is no longer classified as natural. Instead, these situations fall into other category, which is accident, as they involve external elements that contributed to the outcome. The second one is homicide. Homicide is a legal and medical classification used when a person's life is intentionally and unlawfully taken by one or more individuals. This classification is not limited solely to acts of murder, but encompasses all instances where one person's action result in the death of another. Homicides may include various degrees of intent, such as premeditated murder, manslaughter, or justifiable homicide in self-defense. Each of these categories involves distinct circumstances and legal consequences. Homicide cases require thorough investigation, often involving law enforcement, forensic experts, and legal authorities, to determine the exact circumstances, intent, and culpability of those involved in the individual's death. And the third one is what I have mentioned earlier, the accidental deaths. So it pertains to situations where the fatal outcome was unintended, and there is no evidence to suggest that the injuries leading to death were inflicted with the purpose of causing harm. Accidental deaths result from unforeseen events or mishaps that can encompass a wide range of scenarios. This may include tragic incidents such as car accidents, slips and falls, industrial accidents, and other occurrences where harm was not intended consequence. The key defining factor in these cases is that the circumstances leading to death were primarily accidental, without a deliberate intent to cause harm or take a life. Investigating accidental deaths often involve a thorough examination of the circumstances, including factors like negligence, environmental conditions, and human error, to ascertain the exact sequence of events that led to the tragic outcome. And the fourth manner of death is suicide. Suicide is the classification used when an individual intentionally takes their own life. So it is a complex and deeply personal act that often arises from a range of psychological, emotional, or situational factors. Suicide is a critical concern for mental health professionals, as it underscores the importance of understanding and addressing issues related to mental well-being and emotional distress. Investigations into suicides may involve psychological evaluations, interviews with friends and family, and an exploration of the individual's history to gain a comprehensive understanding of the underlying factors leading to this tragic act. The last manner of death is undetermined. The classification of undetermined arises when all available information, even after a thorough investigation, does not conclusively point to one manner of death being more compelling than one or more other competing manners of death. For instance, in cases involving partial skeletal remains where critical context details are absent. So in such cases, there is an ambiguity surrounding the exact circumstances leading to the individual's death. This classification is typically reserved for situations where the evidence does not definitively align with a single manner of death, such as natural, accidental, homicidal, or suicidal. Undetermined cases may necessitate further investigation, additional evidence, or expert analysis to reach a conclusive determination, ensuring that all possibilities are exhaustively explored before a final classification is made. So recapping, we have explored the 5 manners of death: natural, homicide, accident, suicide, and undetermined. Now let's shift our focus to a detailed discussion of the various types of natural deaths, which will be presented by Ms. Maria Lourdes Magtaas.
Santa Barreto. Now that we have an established overview of the natural, we'll now go on to its specific types. For my discussion, I will be tackling the causes of natural death based on the vital organ systems in the human body, such as the cardiovascular system, respiratory system, nervous system, and the gastrointestinal system. So the first cause of natural death is from the cardiovascular system. So a vast majority of sudden natural deaths are a result of diseases that are related with the cardiovascular system. Some of these include ischemic heart disease or coronary heart disease, hypertensive heart disease, arrhythmias, and aortic valve disease. The most common cause of natural death among these diseases is ischemic heart disease or coronary heart disease. From the word itself, ischemic, it refers to a condition or a situation in which there is a reduced or inadequate blood supply to a particular organ or tissue in the body. It is derived from the Greek word ischamos, which means stopping blood. The underlying cause of ischemic heart disease is the gradual buildup of atherosclerotic plaque within the coronary arteries. Over time, these plaques can narrow the arteries, reducing blood flow to the heart. When the coronary arteries become narrowed or blocked by atherosclerotic plaque, the heart muscle may not receive an adequate supply of oxygen-rich blood. This results in chest pain or discomfort known as angina. In some cases, a plaque within a coronary artery may rupture, causing a blood clot to form at the site of the rupture. This blood clot can completely block the artery, leading to a myocardial infarction or heart attack. A heart attack occurs when the portion of the heart muscle becomes damaged or dies due to lack of blood flow and oxygen. Several risk factors can contribute to the development of ischemic heart disease, including smoking, high blood pressure or hypertension, high cholesterol levels, diabetes, obesity, a sedentary lifestyle, a family history of heart disease, and age. The next common cause next to ischemic heart disease is hypertensive heart disease. Hypertensive disease, also known as hypertension or high blood pressure, is a medical condition characterized by elevated and consistently high blood pressure levels in the arteries. It is a common chronic condition and is often referred to as the silent killer because it can be asymptomatic for years while gradually damaging vital organs. Hypertensive disease itself is not typically considered a direct cause of natural death in forensic medicine, but rather it can lead to various complications and conditions that may contribute to natural death when it comes to hypertensive heart disease. Hypertensive heart disease is a medical condition that results from chronic high blood pressure or hypertension adversely affecting the heart. You may be wondering why it affects the heart, and the reason is very simple. Persistent high blood pressure forces the heart to work harder to pump blood throughout the body. Over time, this increased workload can lead to the thickening and stiffening of the heart muscles, a condition known as left ventricular hypertrophy or LVH. This in turn reduces the heart's ability to efficiently pump blood and can eventually lead to heart failure. Hypertension is a significant risk factor for the development of coronary artery disease, which was discussed earlier. Furthermore, as hypertensive heart disease progresses, the heart may become unable to pump blood effectively, leading to heart failure. Heart failure can result in symptoms such as shortness of breath, fluid retention, and fatigue. In severe cases, it can lead to natural death due to compromised ability to supply oxygenated blood to the body's organs and tissues. Chronic hypertension can also disrupt the heart's electrical system, increasing the risk of arrhythmias or abnormal heart rhythms. Ventricular arrhythmias or ventricular fibrillation or ventricular tachycardia can lead to sudden cardiac arrest and natural death. Lastly, hypertension can damage the blood vessels in the brain, increasing the risk of ischemic strokes, which is caused by blocked blood vessels, or hemorrhagic strokes, which is caused by bleeding in the brain. Stroke-related complications can lead to natural death in individuals with hypertensive heart disease. As you can see in the picture, a person who died due to hypertensive heart disease tends to become enlarged. The thickness of the walls of the heart's chambers of the dead person are more than its usual percentage. For instance, in the septum, the weight should be only 15.1%, but for the dead person, it has become 20.2%. Next, we have natural deaths caused by the respiratory system. So these types of natural deaths can result from various conditions that affect the lungs and the respiratory process. Some common causes of natural death in the respiratory system include chronic obstructive pulmonary disease or COPD, pneumonia, lung cancer, asthma, and interstitial lung disease. Chronic obstructive pulmonary disease or COPD is a progressive and chronic respiratory condition that can contribute to natural death. This disease is usually common among smokers and is also the most common causes of natural death, which involves the respiratory system. COPD is a chronic respiratory condition characterized by persistent and often progressive airflow limitation. The disease primarily affects the airways and lung tissue, leading to chronic inflammation and structural changes. In COPD, long-term exposure to irritants, primarily cigarette smoke, but also environmental factors, triggers chronic inflammation. This inflammation leads to the narrowing and obstruction of the airways, making it challenging for individuals to breathe. Over time, COPD can lead to several visible changes in the lungs, which may be observed through medical imaging or post-mortem examination. Some of these characteristics include emphysema, which is a common feature of COPD and is characterized by the destruction of the walls of the air sacs or alveoli. This can result in larger, irregular air spaces within the lungs. Another is airway obstruction. The airways, which is the bronchi and bronchioles, may appear narrow due to inflammation and mucus accumulation. There is also hyperinflation, in which COPD can cause the lungs to become hyperinflated, appearing larger than normal due to trapped air. Another is reduced lung capacity, in which lung capacity may decrease and the lungs may become less pliable due to the damage to the lung tissue. And lastly, scarring and fibrosis. In some cases, COPD can lead to lung scarring or fibrosis, which may be visible in imaging as denser lung tissue. In severe cases, the cumulative lung changes in COPD can lead to respiratory failure, a life-threatening condition characterized by inadequate oxygen supply and the excess carbon dioxide buildup in the bloodstream, which causes natural death. In forensic medicine, understanding the role of COPD in natural deaths involves examining the extent of lung changes during autopsy. The findings help forensic pathologists determine the cause and manner of death accurately, considering the structural alterations in the lungs and their impact on the respiratory function. Another common and well-recognized natural cause of death in forensic medicine is pneumonia. It is an inflammatory lung condition that results from infection, typically caused by bacteria, viruses, fungi, or other microorganisms. The infection causes inflammation in the air sacs or the alveoli of the lungs, leading to symptoms such as fever, cough, difficulty breathing, and chest pain. Pneumonia can range from mild to severe, and its severity often depends on the type of microorganism causing the infection, the individual's overall health, and the promptness of medical treatment. As the inflammation worsens, it can impair the lungs' ability to oxygenate the blood and remove carbon dioxide, leading to respiratory failure. Infection from pneumonia can also spread to the bloodstream, resulting in sepsis, a life-threatening condition characterized by a systemic inflammatory response. Furthermore, pneumonia can cause the development of lung abscesses, which are localized collection of pus in the lung tissue. In some cases, pneumonia can lead to the accumulation of fluid in the pleural space or the space between the lung and the chest wall, further compromising respiratory function. In forensic medicine, pneumonia-related deaths may be investigated when there are questions or concerns surrounding the circumstances of death. Forensic pathologists perform autopsies to determine the cause and manner of death. The lung and respiratory system are closely examined for signs of pneumonia, including inflammation, consolidation of lung tissue, and the presence of infectious agents. The presence of pneumonia and its extent are assessed as part of the investigation. For the next natural cause of death, we will be focusing on the nervous system. The following are the causes of natural death in the nervous system: stroke or cerebrovascular accident, neurodegenerative diseases, neuromuscular disorders, brain tumors, autoimmune diseases, and meningitis and encephalitis. Is one of the most common cause of natural death. A stroke is a neurological event that occurs when there is a sudden disruption of blood flow to the brain. This can happen due to two main types of strokes. First is ischemic stroke, which occurs when a blood clot or plaque block a blood vessel in the brain, cutting off blood supply to an area. The second is hemorrhagic stroke, or which occurs when a blood vessel in the brain ruptures and causes bleeding into or around the brain. Stroke leads to brain damage due to the deprivation of oxygen and nutrients, and the brain cells begin to die within minutes of stroke, resulting in neurological deficits. Ischemic strokes are more common and often caused by emboli, or clots traveling from elsewhere in the body, or thrombosis, which are clots forming in the brain's blood vessels. Hemorrhagic strokes can also result from high blood pressure, weakened blood vessel walls, or aneurysms or other vascular abnormalities. Next is aneurysm, which is a localized, abnormal, and a weakened bulge or ballooning of a blood vessel's wall. It can occur in the arteries or veins, but is more commonly associated with arteries. Aneurysms can develop due to factors such as hypertension or high blood pressure, atherosclerosis or plaque buildup in arteries, genetic predisposition, or traumatic injury. The most significant concern with an aneurysm is the risk of rupture. When an aneurysm ruptures, it leads to sudden and often massive bleeding into the surrounding tissue or body cavity. In forensic medicine, aneurysms can be considered a natural cause of death when a ruptured aneurysm causes extensive internal bleeding. This can result in natural death due to hemorrhagic shock or organ dysfunction secondary to blood loss. Another vital system that causes natural death is the gastrointestinal system. This includes gastrointestinal cancers, gastrointestinal hemorrhage, cirrhosis, inflammatory bowel disease or IBD, acute pancreatitis, or infections. One of the most common cause is gastrointestinal hemorrhage. Gastrointestinal hemorrhage refers to significant bleeding that occurs within the gastrointestinal tract. This bleeding can originate from various sources within the GI tract, including the esophagus, stomach, small intestine, or large intestine. Its common causes are the following. First is peptic ulcers, which are open sores that form in the lining of the stomach or the upper part of the small intestine. These can bleed profusely, especially if they erode into a major blood vessel. Second is esophageal varices. These are enlarged and weakened blood vessels in the esophagus, often associated with liver disease or cirrhosis, and if they rupture, severe bleeding can occur. Second is Mallory-Weiss tears, which are small tears or lacerations in the mucous membrane that lines the junction of the esophagus and the stomach. They result from severe vomiting or retching and lead to significant bleeding. Next is diverticulosis. Small pouches or diverticula that can form in the walls of the large intestine become inflamed or can bleed, which can lead to gastrointestinal hemorrhage. Lastly, gastric or duodenal cancer. Malignant tumors in the stomach or gastric cancer or the upper part of the small intestine cancer, which is duodenal cancer, can erode into blood vessels and cause bleeding. In cases involving death due to gastrointestinal hemorrhage, forensic pathologists examine the GI tract, including the stomach and the intestines, during autopsy. They assess the extent of bleeding, any ulcers or lesions, and the potential source of hemorrhage. The examination helps determine the cause and manner of death, documenting the presence of conditions that contributed to the bleeding. So natural causes of deaths are not only limited to systems that we have discussed. There are also other systems that are involved in the natural causes of death. First is in pregnancy. Sudden deaths are usually associated with hemorrhage, and the rupture of an extrauterine pregnancy may produce a massive intra-abdominal hemorrhage, which on occasions has caused death. The adrenal gland may also be related to a sudden death as a result of bilateral adrenal hemorrhage produced during a meningococcal septicemia. For the next report, I will now call on Richmulan Sabeliana to discuss about the cases involving natural death and the role of forensic medicine in its investigation.
Thank you, Ms. Lourdes Magtaas. So I will discuss cases involving natural death and the role of forensic medicine in its investigation. So in our first case, I've made a hypothetical case scenario wherein natural death is present. The case of Lourdes Elizabeth Turner Cruz. Mrs. Lourdes Elizabeth Turner Cruz, an 80-year-old woman with a history of COPD or chronic obstructive pulmonary disease and diabetes, had been managing her chronic conditions with medication and periodic checkups. However, during the winter season, she began experiencing a persistent, severe cough, high fever, and increased difficulty in breathing. The cough was accompanied by yellowish phlegm and occasional chest pain. Concerned about her worsening symptoms, her family brought her to the hospital. On examination, Mrs. Cruz appeared fatigued and was visibly struggling to breathe. Auscultation of her chest revealed crackling sounds indicating fluid in her lungs. A chest X-ray was ordered, which showed significant infiltrates and consolidation in both lungs, consistent with severe bacterial pneumonia. So, what are the roles of forensic medicine to this scenario? Also, first, let's have the medical evaluation. Blood tests indicated a high white blood cell count, suggesting an ongoing infection. The presence of bacterial pathogens was confirmed through sputum culture analysis. Mrs. Cruz's oxygen levels were progressively declining, necessitating supplemental oxygen therapy to maintain adequate saturation. Her cause of death is, despite aggressive treatment with appropriate antibiotics and supportive care, Mrs. Cruz's condition rapidly deteriorated due to the severe bacterial pneumonia. The infection led to widespread inflammation and fluid accumulation in her lungs, causing acute respiratory distress syndrome or ARDS and ultimately resulting in respiratory failure. Despite the medical team's best efforts, Ms. Cruz succumbed to the complications of the severe pneumonia, which overwhelmed her already compromised respiratory system due to COPD. Next is the roles of forensic to this scenario. The cause of death determination. Forensic pathologists examine the deceased individual's body, analyze medical records, and conduct autopsies to determine the precise cause of death. In this scenario of respiratory failure due to pneumonia, forensic experts confirm the cause of death as severe bacterial pneumonia, leading to acute respiratory distress and failure. For the detailed autopsy and examination, forensic experts perform a true autopsy focusing on the lungs and respiratory system. They assess the extent of lung infection, damage, and fluid accumulation. This examination provides crucial insights into the progression and severity of pneumonia and its contribution to respiratory failure. For histological examination, tissue samples from the lungs and other relevant organs are examined under a microscope. This microscopic analysis helps identify specific types of pneumonia, for example, as the bacterial or viral, tissue damage, and inflammatory response, aiding in confirming the diagnosis. Next slide. For the toxicology testing, toxicology analysis is conducted to detect the presence of drugs, alcohol, or other substances in the body. In cases of respiratory failure, it's essential to rule out any drug-related causes that might have contributed to the individual's condition or interactions with prescribed medications. For documentation of pre-existing conditions, forensic experts document any pre-existing medical conditions such as COPD and diabetes, which may have influenced the progression and outcome of the pneumonia. Understanding these pre-existing conditions is crucial in determining the overall impact on the individual's health. For time of death estimation, forensic pathologists may estimate the approximate time of death based on various factors, including the progression of the disease, medical history, and witness statements. This estimation helps in establishing a timeline of events leading up to fatal outcome. And lastly, the court testimony. Forensic pathologists and other experts may provide expert testimony in legal proceedings, presenting their findings and interpretations in a clear and understandable manner to assist in the investigation and potential legal actions related to the case. So, of course, aside from hypothetical case, I provided a factual case wherein natural cause of death has been reported. The Christine Tessera case, is it homicide, rape, or natural death? The case of Christine Tessera is a highly publicized and sensitive legal matter that occurred in the Philippines. Christine Angelica Tessera, a 23-year-old flight attendant, was found dead in a hotel room in Makati City on New Year's Day in 2021. The circumstances surrounding her death and the subsequent investigations have garnered significant media attention and public interest. So first, the events leading to Christine Tessera's death. On New Year's Eve, Christine Tessera attended a party at the Makati City Hotel with friends and acquaintances. They were celebrating the arrival of the new year. However, the following morning, Tessera was found unconscious in the hotel bathtub. She was rushed to the hospital but was declared dead on arrival. For the initial suspicions and autopsy, initially, the cause of death was suspected to be intoxication or a medical condition. However, a forensic autopsy revealed indications of possible sexual assault and trauma. The initial findings led to allegations of rape and suspicions of foul play. For the arrest and charges, several several individuals present at the party were initially charged with rape and homicide. The Makati City Police filed the charges based on the initial findings and testimonies. However, some of the suspects were later released due to lack of evidence to support the allegations. Next slide. For the subsequent autopsy and cause of death, a subsequent autopsy was performed by National Bureau of Investigation or NBI Medico-Legal Officer. The NBI autopsy concluded that the cause of death was a ruptured aortic aneurysm, a medical condition involving a weakened area in the aorta, the main blood vessel that carries blood from the heart. For the discrepancies and ongoing investigation, there have been discrepancies and conflicting statements from individuals present at the party regarding the events leading up to the Sarah's death. As of the last update, the case remains open and authorities are still investigating to determine the accurate sequence of events and the circumstances surrounding her passing. For the public and media response, the case received spread media coverage, and triggered public debates regarding the handling of the investigation, the presumption of innocence, the importance of due process, and the impact of media exposure on the case and those involved. Next slide. So, as for the manner of death, according to PNP Forensic Crime Laboratory report, the PNP Crime Laboratory report ruled out homicide as the cause of the Sarah's death. There have been speculations that the Sarah's drink was spiked, which could have triggered the aneurysm, but the report said that no alcohol or recreational drugs taken the night prior to her death will cause that kind of dilatation or defect on her aorta. It likewise noted that the dilatation or aneurysm started a long time ago. That dilatation is a chronic condition and was present long before she died. If she did not die that fateful night, she will still die in any scenario that presents an activity that will increase her blood pressure strong enough to tear that aneurysm, the report stated. Next slide. It also noted that the Sarah's heart weighs 500 to 200 grams higher than a normal heart. This is, according to the report, this is a finding that supports the Sarah's apparently undiagnosed hypertension. In the person of the Sarah, this happened in the aorta that the continuous increase in her blood pressure within it further weakened that defect and eventually burst, the PNP Crime Laboratory report pointed out. For the moment there was a tear in the aorta, blood loss will occur and the patient is expected to feel various symptoms like weakness, nausea, and diaphoresis that can explain why she was feeling weird and unlike the feeling of a hangover from a previous drinking sessions. The loss of blood due to the ruptured aorta killed her within a few hours. So for the roles of forensic medicine to the case of Christine Dacera is first the cause of death determination. Forensic medicine, through detailed autopsies and examinations, played a crucial role in determining the cause of Christine Dacera's death. By analyzing the physical evidence and conducting thorough examinations, forensic experts identified that the cause of death was natural in origin. Second is the autopsy and examination. Forensic pathologists conduct a meticulous autopsy focusing on various organs and systems, particularly the respiratory and circulatory systems. This examination provided crucial insights into the pathological conditions that led to Christine Dacera's demise, supporting the conclusion of a natural cause. For the histological examination, tissue samples were likely examined histologically to study the microstructure of organs, especially the lungs, to identify any signs of pre-existing medical conditions or natural disease processes that may have contributed to her death. For the medical history analysis, forensic experts considered Christine Dacera's medical history, including any known pre-existing conditions. Analyzing her medical background was essential in understanding how these pre-existing conditions might have interacted or exacerbated her health, contributing to the natural cause of death. In addition to that, toxicology analysis, although not explicitly mentioned in the provided title, forensic toxicology could have been utilized to rule out the presence of drugs or substances that might have influenced the cause of death, further supporting the conclusion of the natural cause. For the expert testimony and report, forensic experts likely presented their findings in a clear and professional manner, providing a comprehensive medico-legal report. This report outlined the evidence, examinations, and reasoning behind the determination of a natural cause, emphasizing the scientific rigor applied in forensic medicine. And last, the rule out homicide and rape. The importance of forensic medicine in excluding possibilities of foul play, such as homicide and rape, is by conducting a true investigation and examination. forensic experts can definitively state whether the cause of death was due to natural factors or any criminal actions. However, for the latest update of this case dated last February 7, 2022, Makati prosecutors junked the complaints against the companion of flight attendant Christine Dacera. These include complaints of drug violations, obstruction of justice, perjury, and reckless imprudence resulting in homicide. The prosecutors also dismissed complaints by Dacera's companions against her mother, including illegal detention, arbitrary detention, unlawful arrest, unjust vexation, perjury, slander, libel, cyber libel, incriminating innocent person, intriguing against honor, and malicious prosecution. So, aside from those cases, we also have known individuals who died from natural causes of death, both local and international. Next slide. First, we have a local artist, Rodolfo Vera Quezon Sr., popularly known as Dolphy, who was a well-loved Filipino actor and comedian. He passed away on July 10, 2012. The cause of his death was chronic obstructive pulmonary disease or COPD and multiple organ failure. COPD is a progressive lung disease that makes it hard to breathe and is often caused by long-term exposure to irritating gases or particulate matter, most commonly from cigarette smoke. Dolphy had been dealing with health issues for several years leading up to his passing. His condition worsened and he was hospitalized multiple times before succumbing to the complications associated with COPD and multiple organ failure. Second is from International, which is Whitney Houston, an acclaimed American singer and actress who passed away on February 11, 2012. The cause of her death was ruled as an accidental drowning, with heart disease and cocaine use identified as contributing factors. Houston was found submerged in a bathtub in her hotel room. The autopsy and toxicology report indicated that she had several drugs in her system, including cocaine, marijuana, Xanax, and Flexeril at the time of her death. Heart disease was also identified during the autopsy, suggesting it played a role in her passing. It's essential to emphasize the drug abuse and heart disease as it is significant in health issues that can lead to complications and in some cases fatal outcomes. In Whitney Houston's case, the accidental drowning occurred in the context of drug use and pre-existing heart disease, contributing to her tragic and untimely death. Third is also from International, which is Michael Jackson, the king of pop and a legendary American singer, songwriter, and dancer. He passed away on June 25, 2009 at the age of 50. The cause of his death was determined to be acute propofol and benzodiazepine intoxication, which was administered by his personal physician, Dr. Conrad Murray. Propofol is a powerful anesthetic, and benzodiazepines are a class of sedative medications. The lethal combination of these drugs, particularly propofol, led to respiratory and cardiac arrest, resulting in his untimely death. Dr. Conrad Murray, who has convicted of involuntary manslaughter in 2011, administered these drugs to help Jackson sleep, but did so in an inappropriate and dangerous manner outside of a hospital setting, contributing to the fatal outcome. The case highlighted the dangers of using potent medications without proper medical oversight and monitoring. And lastly, from local, we have Miguel Castro Enriquez, or also known as Mike Enriquez, who passed away last August 29, 2023. According to his wife, Baby Enriquez, his blood pressure dropped and suddenly his heartbeat stopped, which is considered as cardiac arrest. With that, before we conclude this discussion, let's have our key takeaways. For our introduction, Ms. Samantha Barreto shared her journey through this presentation, which led us to the following essential insights. First is death. Death marks the irreversible cessation of both circulatory and respiratory functions. It's the conclusion of the body's vital life processes. Second is the tripod of life. The brain, heart, and lungs constitute the tripod of life together, and they sustain life, and their proper functioning is paramount for survival. Third is the cause of death. Deaths are categorized into two main causes: the natural causes, which result from diseases, illnesses, or internal organ failures. Homicidal or suicidal causes result from external actions or self-inflicted injuries. Fourth is the manner of death, which the manner of death indicates the circumstances leading to the cause of death, and it can be classified into five categories. The natural death resulting from a disease or internal malfunction; homicide, death caused by another person; accident, death resulting from an intentional injury; suicide, death resulting from a self-inflicted harm; undetermined, when the manner of death cannot be conclusively determined based on available information. So understanding the intricacies of death, its causes, and manners is fundamental in various fields, including medicine, forensic sciences, and law. It provides a foundation for medical practitioners and investigators to comprehend and elucidate the circumstances surrounding an individual's passing. So next, as we conclude our presentation on the various types of natural causes of deaths, let's recap the key takeaways of Ms. Maria Lourdes Magtaas on understanding these natural causes, which are crucial for medical professionals, researchers, and the general public to appreciate the complexities of human health and morality. The types of natural causes of death. So we have the cardiovascular diseases. It is diseases affecting the heart and blood vessels as a major group of natural causes of death, highlighting the need for preventive measures and cardiovascular health awareness. We also have the respiratory diseases, which has a range of respiratory conditions including chronic obstructive pulmonary disease or COPD and pneumonia, contribute contribute significantly to natural deaths, emphasizing the importance of respiratory health. We also have neurological disorders. Conditions such as Alzheimer's and Parkinson's disease play a role in natural deaths, prompting research and healthcare efforts to improve understanding and treatment. Aside from this system, there are also other systems in the body who contribute to natural causes of death of a person. Next. As for the cases involving natural death and the role of forensic medicine in its investigation, first is the hypothetical case scenario of Lourdes Elizabeth Turner Cruz, which talks about an 8-year-old female with a history of chronic obstructive pulmonary disease or COPD and diabetes develops a severe cough, high fever, and difficulty breathing. The cause of death is the respiratory failure caused by bacterial pneumonia, leading to severe infections in the lungs. And the second is the Christine Deseret case, which serves as a poignant reminder of the intersection between law, media, and public engagement. It emphasizes the necessity for a fair and impartial legal processes, showcasing the responsibility shared by both the legal system and the media to ensure justice and uphold truth. Third is for the known individuals who died from natural death, local and international. We have Dolphy, who died last July 10, 2012 because of COPD. Whitney Houston died last February 11, 2012 because of drug abuse and heart attack. Michael Jackson died June 25, 2009 because overdose to sedatives resulted to cardiac arrest. And lastly, the Miguel Castro Enriquez, or also known as Mike Enriquez, died last August 29, 2023 because of cardiac arrest. And thus conclude our discussion of natural causes of death. Thank you for listening.
Okay na po, Doc.
Sige. 8 ang absent. Siguro mahina din yung kanilang mga wifi ngayon. Pwede niyong bigay sa akin yung PDF niya, PPT, tsaka yung recording.
Sige po, Doc. Sa drive na lang po.
I-edit ko lang yung yung doon sa mga kay Dolphy tsaka kay Enriquez, sino pa ba yun? Whitney Houston tsaka kay sino isa?
Kay Dasera po.
Hindi yung
Michael Jackson.
Michael Jackson. Tatanggalin natin yung natural death doon. Ang ilalagay na kasi ang cause of death ni Whitney was accidental drowning secondary to drug overdosage resulting into cardiac arrest yun. Hindi natural death yun. Merong cause. Kasi kung hindi mo ilalagay yung cause leading to cardiac arrest, walang kaso. Di ba? Naintindihan niyo?
Yes po.
Oo. Yung kay kay sino to? Yung kay Dolphy, pwedeng natural death. Kasi wala tayong record kung may poisoning o merong ano tawag doon? Circumstances ng death. Yung kay Jackson, ganun din. Dapat yun ay drug overdose resulting into cardiac arrest. Yeah. Ultimately, cardiac arrest due to drug overdose. Okay. So, ganito yun. Bawa, may nabaril. Bawa na tinamaan ng bala yung heart. Pag ang inilagay na cause of death doon ay cardiac arrest, secondary to gunshot wound, pag nagkaroon ng hearing, doon tututok yung defense panel sa cardiac arrest. Kaya ang tatanungin niya sa doktor doon sa nag-autopsy, anong cause of death? Cardiac arrest. Yun ang nakalagay sa record. Tapos titigil na yon. Sasabihin niya sa judge, that's our fault now. Kung smart yung prosecution or yung fiscal, may follow-up question yon. At tatanungin niya ulit yung witness. So what is the cause of cardiac arrest in this case? Siyempre sasagot yung doktor. It is a gunshot wound to the chest involving the heart. Yun. Tiyak na hindi nasasagot yung sa defense panel kasi yung defense panel tumututok lang sa cardiac arrest. Hindi binabanggit yung gunshot wound to the chest. Naintindihan ba?
Yes po.
Kung hindi nag-follow up yung prosecution, walang kaso. Walang homicide case o murder case. Dahil namatay ng natural death. Yun. Ganyan dapat ang mga medico-legal case. Bawa, namatay sa ospital, ah, pneumonia, yan. Namatay sa ospital yung isang lalaki, mga 50 years old, ng pneumonia. Bakit siya na ospital? Kasi sinaksak siya say sa tiyan. Wala namang infection sa tiyan pero nakasurvive siya sa hospital. Okay? After 10 days, the man died. Okay. Ang nakalagay sa death certificate ay pneumonia. Kung pneumonia lang nakalagay, walang kaso, di ba? Hindi nabanggit yung stabbing o stab wound sa abdomen. So ang dapat doon, pneumonia due to wound stab abdomen. Yan. Kasi pag yung defense lawyer, kagaya ng binanggit natin kanina, mautak yon, gustong lumusot yung kanyang kliyente, tatanungin ganyan yung doktor, doktor, what is the cause of death of this patient who was hospitalized? Pneumonia. Biglang magsasara na yung defense lawyer. That's all for the witness, Your Honor. Okay? Tapos biglang sasabihin ng judge, okay. Any direct questions? Pag smart yung prosecutor at saka yung private attorney for the prosecution, yes, Your Honor, we have a redirect examination. Tatanungin niya ulit yung witness. Doctor Sabillena, what is the cause of pneumonia of this patient? Sasagot si Dr. Sabillena. Pneumonia due to stab wound on the abdomen. Okay. Tapos siyempre, sasagot din yung defense lawyer. Can we do a recross examination on the doctor? Sasagot naman yung judge. Yes. Doctor, yung defense lawyer naman ang sa tatanong. Was it not that the patient died of pneumonia? Siyempre sasagot yung Dr. Civilian. Yes. Was it not the patient was in the hospital dying of cardiac arrest? Yes. Biglang magtitigil yung yung titigil magtanong yung defense lawyer. Minsan napapasagot ako ng but sasabihin sa akin ng defense lawyer, I am only asking you what is the cause of death. Nothing more, doctor. Kung matibay yung smart yung private lawyer for the prosecution o fiscal, magre-redirect ulit yun. Was it not that the patient died of pneumonia due to a stab wound to the abdomen? Sasagutin naman ng Dr. Sabillena o ako ay sasabihin ko, yes. Tapos biglang pag natauhan na yung defense lawyer, sasabihin, hindi na yung mag-re-cross exam. Sasabihin naman ng fiscal, that's all for the witness. Naintindihan ba? Hello?
Yes po, Doc.
Dapat merong cause of death yun, kahit na natural. sa legal terms, sa medical legal terms, pag ang death ay due to medical legal matters, merong cause leading to a natural death, kagaya ng cardiac death. Yeah. But we do not call it natural death anymore, but stab wound to the abdomen leading to pneumonia. Yan. Para may kaso. Kasi kung cardiac arrest lang, ilalagay mo, walang kaso yun. Okay ba yun? Hello?
Yes po.
Magagalit yung mga pamilya sa sa doktor. Bakit naman ninyo sinabing cardiac arrest lang? Hindi nyo binanggit yung stab wound sa abdomen. Meron kaming kasang ganyan. Ako, natalo. Mahigit 1 milyon ang nagasta ng ng pamilya dahil nagkamali lang nasagot yung yung isang doktor. Anyway, hindi nakatanya ibagawa ng mahina ang wifi. Kung wala na kayong question, that's all for today. Okay. Kuna mo na yung screenshot, Mr. Kerbin, Miss Samantha.
Sige po, Doc.
Kasi send nyo sa akin. Tapos mag-tick kayo sa LMS attendance for legal purposes. Okay? Good afternoon. Okay.
Thank you po, Doc.
Thank you po.
Thank you po.
Sige, thank you.
Thank you po.
Thank you.